I was shopping one afternoon in a bookstore, looking for a book for my husband, and I noticed something strange. I had something in my pocket that was very heavy, and I thought, well, I didn't put anything in my pocket, so I pulled my hand out, and I realized at that point in time, 3 of my fingers and part of my arm were numb.
A stroke is an event that happens generally sudden or rather rapidly. There are many causes for strokes, but if we think about strokes in 2 different ways, one is when the area of brain does not get enough blood flow and oxygen. Those are called ischemic strokes. And then there are strokes that are caused when there's bleeding in or around the brain called hemorrhagic strokes. People should remember several symptoms. Sudden numbness on one side of the body, sudden weakness on one side of the body, loss of vision in one or both eyes, significant unsteadiness while walking, and sudden worst headache of one's life like no other, especially if it's associated with a stiff neck or passing out.
In the emergency department, we refer to strokes as brain attacks, much like a heart attack, very analogous to those 2 things, because we want to instill upon people the urgency of getting these strokes treated. So if there's any thought of a stroke, any concern for strokes, it's important to get to the emergency department as soon as you can, 911 if necessary.
The quicker we can have patients get to a hospital, the better likelihood we might be able to stop a stroke from happening and improve their chances for a better functional outcome. Because we're losing millions of brain cells every moment that the brain is deprived of oxygen from a stroke. So time is brain.
911 brings a whole host of treatment options to the patient. They can give support from a paramedic's perspective when the ambulance comes. They can give us a heads up in the emergency department so that we can get all these medications, get the CT scanner ready. It's very important that it's the most time-effective way to not only get treatment to the patient, but also let us know what's happening with the patient before they get here.
And within, it seemed like just minutes, that the ambulance was there and drove me down to St. Mary's, where I met the most wonderful staff that I could ever imagine meeting. The nurses were there, the neurosurgeon was already there, and they were ready for me.
For those hospitals that have dedicated stroke treatment programs, like we do at Dean St. Mary's, they can alert the stroke team, the emergency room physician, the emergency room nurses who've all been trained in acute stroke management, as well as contacting the neurologist who is available 24/7 to be able to see that person as quickly as possible.
Well, it's very important that people get to a certified stroke center because we have all of the technology, all of the subspecialty physicians, an emergency department that's ready to act upon a moment's notice. We feel that a certified stroke center makes us the best qualified in the area to treat strokes and have the best outcomes as possible.
Don't ignore any symptoms that you might have. Doctors, hospitals, nobody minds if you come in with symptoms and they're really nothing.
It's always better to err on the side of caution, even though it's embarrassing for somebody to call the paramedics and then it turn out to be something that isn't serious. It's always better when you're working with risking your life and your ability to function for the future, not to even think about that. Get to a hospital immediately, because hospitals have the ability to rapidly evaluate a patient to determine, are they having a stroke, and try and look for correctable conditions that may be able to stop it or reduce the amount of damage that is happening.
Well, in order to diagnose stroke, imaging is very important. The neurology would like to get a CAT scan of the brain as soon as possible. Our goal with somebody that presents to the emergency department is within 5 minutes of coming to the emergency department, they have a CAT scan done. That can diagnose the stroke and help us determine the best treatment options as soon as possible.
One of the medications that we can use is a medicine called tissue plasminogen activator, otherwise known as TPA. that medication can help dissolve a clot in certain circumstances.
It's one of the miracles of modern medicine. We see someone come in with a facial droop, unable to speak. We can give them the medication in their veins. The clot that's causing the stroke releases, allowing blood flow back to the brain, and they are back to normal within minutes. It's truly a miracle.
Sometimes if the clot is too large, we can take the person to the interventional radiology suite where our team of interventional radiologists can either administer more clot-dissolving medication through a catheter threaded up to one of the arteries in the brain, or even try and extract the clot mechanically with a device that's threaded through a long, thin tube that travels up to the brain, hoping to restore circulation. There's not one form of treatment that is perfect for every person. That's why it's so important to take a careful history and a careful physical examination, look at the imaging studies, and then make a decision. What is the best treatment for that patient?
Age is definitely a risk factor for all kinds of stroke, both ischemic and hemorrhagic. As we get older, the risk of stroke goes up. High blood pressure is a major indicator of possible stroke. We also look at diabetes. Well-controlled diabetes is very important to preventing stroke, and also high cholesterol in the blood. There's a lot of good medications that treat all three of these diseases to help decrease the risk of stroke, especially as we get older.
We should do everything we can to minimize our risk factors before we have a stroke. That's our best stroke treatment, to prevent it before it happens. One of the best things that was ever done to limit the number of strokes or minimize the number of strokes was control of blood pressure. So it's very important that people have their blood pressure checked regularly, avoid salt if they can, eating a healthy diet that has a limited amount of red meat and saturated fat and fried foods. So much more chicken, much more oily fish like salmon, much more vegetables. Keeping our weight down, avoiding that central obesity, that large fat store in the middle of one's body, which is very dangerous for developing atherosclerosis in both stroke and heart attack. Exercise is profoundly important. 30 minutes of moderate exercise a day can be an incredible lifesaver down the road. Just walking quickly for 30 minutes a day really can make a difference over the course of time at minimizing somebody's risk for stroke. So our best treatment for stroke is stroke prevention before it happens. It's just like heart attack prevention before it happens. Prevention doesn't begin in our 30s or 40s or 50s. Prevention begins in childhood. And it's really important. I've seen over my lifetime kids going from skinny in elementary school to heavy. The atherosclerosis, that narrowing of blood vessels, starts with our eating habits, and it starts with our exercise, with children's exercise. So it's very important for parents to recognize if they want to give their children the best opportunity in life, it's to make sure they get out and they run around and they play the way that we did when we were kids. Not to sit in front of the TV all the time with playing video games, not to eat junk food, but to actually get out and have that physical activity and make that an incredible fun part of life that will stay with kids forever.
Within a day or so, I was pretty much normal, and I felt after effects from it, but I knew I was going to make it.
I have two take-home messages for people about stroke. The first one is, do everything we can to prevent it before it happens. All those risk factors that we can control, diabetes, high blood pressure, watching our weight, getting exercise, not smoking, those are critical. Making sure that our children are eating healthy and getting enough exercise so they don't get heavy and develop atherosclerosis, which starts at an early age. My second message is, time is brain. If a patient has one of those stroke symptoms that we talked about, err on the side of caution, call 911, get to the hospital immediately. If it isn't a stroke, or if it's something that looks like a stroke but isn't, that's okay. But we can really make a difference in how people live and their ability to function by rapidly evaluating and treating stroke.
I think Dean and St. Mary's are in a very excellent position to benefit the community in terms of treatment of stroke, because Dean St. Mary's has put the personnel in place, has the technology at our fingertips in order to create the best outcomes for such a tragic disease such as stroke.